Good afternoon, Madam Chairman. Thank you for giving me the opportunity to address your committee on this very important issue of mental health today. My name is Atewologun, and I would like to speak about HR3548, Pursuing Equity in Mental Health Act. Mental illness includes disorder that affects thinking and mood and behavior of a person. And there's some few factors that contribute to mental illness, such as biologic makeup of a person, a childhood abuse or neglect, experiencing discrimination and stigma, and also losing someone that is very dear to a person. So WHO defines health as a state of complete physical, mental, and social wellness. So my next slide will be talking about historical background of mental health. So people of ancient times believed that any sickness that indicated displeasure was a punishment for sins and wrong. So people that has mental illness are viewed as demonic. So they are ostracized, they are punished. So the treatment is aimed at restoring balance through bloodletting. I have a picture on the left side here of a woman that they are taking out blood from her. So what they're doing is the treatment is aimed at restoring balance through bloodletting and purging. So to rid the body of impure fluids to cure a host of conditions by cutting an artery or vein. So in 1790, Philippe Pinard and William Tuke, they came up with the concept of asylum. So they're offering protection for mental health patients. And so Dorothy Dix also began a crusade to reform treatments of mental illness. And so Sigmund Freud began to study psychiatry and the diagnosis and treatment of mental illness. So the psychopharmacology came to being. So they were using a lot of typical and atypical antipsychotic medication for psychosis and also benzodiazepine to manage anxiety disorders. So with the overview of the mental illness issue, it shows that 51.5 million adults in US in 2019 had mental disorders, and is only 23 million received treatment within past year. And nearly 11 million children and adolescents are diagnosed with mental disorder such as ADHD, anxiety, and depression. More people are being treated for mental illness, especially the homeless population and incarcerated and patients who are experiencing mental illness and substance abuse. The Healthy 2010 focused on reducing suicide rate attempt by coming up with screening upon admission of patients for any mental issues or any depressive episode. So the aim for the future is to improve health quality of life of a person affected with mental illness. So the background of the bill HR348, it was introduced in the House of Representatives on May 18, 2023. However, there was a first bill which was also championed by the same wonderful, strong lady, House of Representative Bonnie Watson Coleman for Mental Health Act bill. So this bill was first introduced in the 117th Congress as HR 1475 by Representative Bonnie Watson on March 1st, 2021. So the initial bill garnered support from 86 Democrats and one Republican, demonstrating a bipartisan appeal of mental health. And so if the committee approves the bill, it will be reported to the House of Representatives to address mental health disparities. Due to mental health relevance in today's practice. So because of the COVID-19 pandemic, So there's a need for a coordinated care approaches for those in need of psychosocial support, which include people with lived experiences of mental illness in research and policy making. So attention to look into determinants, the social determinant that encompass mental health and how it affects 5 dimensions of individual, and also understanding of mental issues. There is a growing emphasis on integrating mental health support into everyday practice, which include destigmatizing and promoting early intervention and ensuring access to quality mental health for patients who are affected with mental disorders. So the benefits to the public if HR 3548 was approved would be easy access to the care to reduce suicide rates and also reduce stigma, and also the social economic benefits. And also will improve access to care. So mental equity, that everyone has an equal access to mental health services, which means that individuals from socioeconomic background and ethnicity are able to access care, and no one is left behind. So when people have good mental health, they are more likely to engage and participate in society and engage in meaningful relationship. And also evidence-based practice supported accommodation of services. For example, a patient who is homeless and have a serious mental illness need both treatment and housing with improved quality of life and positive outcome. So either services without the other is less effective. I mean, what good is it to give somebody that's homeless, we give him the medication, but he doesn't have a housing and he's not even sure where it's going to lay his head the next day. So it's afraid. He has that fear, and the anxiety also, we actually lead him back to where he first started, because it's fearful, he can't sleep, and how is the medication going to be effective when he doesn't even have where to get the food from? So it's very imperative for us as healthcare providers to look at those other 5 dimensions of person, and also other things that they will need in order for the medication to be effective, and how would they have transportation to get to where the therapy or where the resources will be. Benefits to the consumer if HR 3548 was approved and passed to law. So there will be a better quality of care, there will be less financial burden, and also better different treatment options and self-advocacy for the patient. So financial burden, so if there is a mental health equity, it helps to alleviate the financial burden associated with mental care. So consumer can access affordable subsidized services, ensuring that cost does not become a barrier to seeking treatment. So with equal access to care, individual can explore different modalities, therapies, and the intervention that align with their preferences. And also for patient self-advocacy, patient will take an active role in their care, and patient can also make an informed decision about their treatments if they are given that chance to be able to have different modalities of treatment. So looking at the quantitative and qualitative data, in US and Canada, 13 to 20% of youth and children have mental health disorder. And in 2017, 22,000 deaths of this age group commit suicide. So looking at the qualitative, we have 51% of boys that commit suicide. This is like more of African American. And then 49% of girls are Hispanic, Hispanic, Black, Asians, and Indian Alaska Native. So according to some of the journal article that I read, it addresses the social inclusion of young adults and children with serious mental illness. They have gone on the rise globally, especially Black African American. They commit suicide. And then what are some of the factors leading to suicide? They said some of the leading factors that is pushing these kids to committing suicide is as a result of childhood maltreatment, depression, and neurocognitive functioning deficits. So we find out that Black Africans ages 5 to 11 years old, they have a higher rate of suicide compared to the girls. And about 2 years ago, we begin to see an increasing rate of girls also committing suicide by hanging and drowning and also overdosing on their parents' medication. So in US, there's greater than 11 million youths who are seen in the emergency department for self-harm behavior, such as overdosing on medication and also hanging themselves or drowning. So CDC has developed a youth risk behavior survey to monitor any self-inflicted behavior. And so for us too, to also be able, when we're doing assessment for our patient, to ask some of those questions that can that for us to assess for any suicidal ideation. So also we want to also assess for any self-concept and sense of identity in context of peer relationship and family dynamic and cultural influences, and lack of coping strategies could be a factor of the high suicide rates in the society. Biblical influence. Psalm 139 verses 13-14 say, "For you created my innermost part, you wove me in my mother's womb." So God creates each and every one of us individually and made every human being with a purpose. So no one is an accident or mistake. So this psalmist assures us that we are made in the image of God, and He knew us before any trauma or any illness come to us. So no matter whatever it is, no matter whatever the problem might be, God is in control. Okay, so these are some of the associations that are recommended to pass the bill into law. So NAMI endorsed the bill to address the disparities and improve workforce development by recognizing the diversity and cultural competence in mental health. And also the National LGBT Task Force has also endorsed the bill so that they can work together with the social worker to focus on the root causes of mental illness and health disparity, poverty, and lack of access and resources for mental health. This will be my last slide. I'll be talking about benefits and opposition to passing Bill HR 3548. So putting more funds to the bill will go a long way with the current shortage of mental health practitioners across the country. So there will be a multiplier effect of this proposed bill, which will boost more healthcare employment. So the opponent's argument was based on purely financial interest, and they ignored the human suffering. They argue that people who have mental illness may be stigmatized, but they failed to know the patient-doctor confidentiality process. So opposition speaks against fiscal conservatives that can contribute to federal saving deficits. So in conclusion, mental health equity benefits everyone by providing equal access to care, improving quality of care, expanding treatments, and promoting positive health outcomes. So I hope the chairman and the distinguished members of the committee will support passing HR 3548 to relieve the suffering of people with mental health. Thank you very much for listening.